Welcome to Doc Talk, a weekly podcast featuring Monument Health physicians addressing medical topics. Tune into your health with Monument Health. Hello, everybody, and welcome again to another edition of Doc Talk with Monument Health. My name is Mark Houston, and joining me today is Dr. Andrew VanOsdol, who is a general surgeon with fellowship training in advanced minimally invasive gastrointestinal surgery in spearfish. You are the only surgeon in South Dakota who is fellowship trained in bariatrics. Really quick, doctor, what is fellowship trained? And that might be a stupid question, but I see it a lot with doctors.
Yeah, it's a great question, actually. And I'll admit medical training is a bit of an enigma to everybody, so it's a great question to ask. So in general, pretty much every doctor goes to residency, so that's going to be like family practice or emergency medicine or internal medicine or pediatrics. So surgeons, general surgeons do 5 years of general surgery residency, where we do we spend time doing vascular surgery and abdominal, general gastrointestinal surgery and all sorts of different things. And then a fellowship year is a year beyond your general surgery training. So really you go through 4 years of med school and then 5 years of general surgery residency to become a general surgeon. So now you can go out and hang your shingle as a surgeon somewhere. So any training on top of that, so for me, I wanted to do I knew that I really wanted to be an expert at minimally invasive surgery. I mean, going into a small town, and that's the beauty about minimally invasive surgery is we're able to do more surgery through smaller incisions, which means at a small town like Spearfish, I can do big operations and people go home the next day rather than needing to spend a week in the ICU and another week in the hospital. So going to a small town, I knew that I wanted to be able to still do big operations, but be able to send people home because I didn't have an ICU necessarily to take care of them for a week. So that's really a fellowship so I spent an extra year of my life where I just pretty much did nothing but minimal invasive surgery on the GI tract essentially for that year.
Okay, that makes sense. That's basically that question was for me. Hopefully other people will take something out of that too. And you're local. I mean, you're from here. Were you born and raised here in Rapid City?
I went to high school here. I moved here when I was in 7th grade.
Oh, so where before that?
My dad was a pastor. We moved around quite a bit on pastors and army or military folks.
Military
around
kid,
a lot,
yeah,
right?
There you go, right.
So Maryland and West Virginia, and then came here in 7th grade, and we stayed here, and then I went to college and everything here too. So.
Oh, excellent. So you must
in South Dakota.
Obviously like the area. It is a great place to live, and so far almost all of the doctors that I've talked to from Monument, the ones that haven't lived here are like, well, we chose it because it's just a beautiful place to live. It feels small town enough, I think, too.
Yeah.
And you hinted at that when you're talking about the procedures you do, and that must make a difference.
Yeah, Spearfish, we love my wife and I both, and my wife's from Rapid City area too, and so we just really wanted to be able to come back to a small town and love the Black Hills. Love the mountain biking and raced in the 5.0 last weekend.
Oh, wow.
It's good.
So why this field for you then?
So bariatrics especially, and it's a little bit odd. I get asked that question a lot. The thing I really like about it, so when I was, and this is a bit of a dichotomous fields, but when I went into surgery, I was debating between psychiatry actually and surgery, which are two very different fields. But the things I liked about them are you actually deal with the problems at hand. So if somebody comes in with high blood pressure and you treat their high blood pressure, well, really they have high blood pressure because their diet's poor and their lifestyle's poor and there's all these other problems. But you don't really have the time or the ability to deal with all that. So I felt like as a surgeon, somebody comes in with a trauma or with a bad gallbladder, you deal with the problem and you fix it. Same thing with psych. Like somebody comes in and you actually try to get at the root cause of the problem. So that's what I really liked about surgery. And bariatrics has this, being a little bit kind of sensitive when I say this, but it's this really fun meld between psychology and surgery actually, because a lot of what we're dealing with are a lot of people that are overweight actually have mental health issues, or they have trauma in their past, or substance abuse, or there's other things going on in their life that have kind of led them to the road of obesity. And so it's as much about dealing with those things. And so when we talk about kind of what we do in bariatrics, a lot of it is behavioral health counseling and nutritional counseling, and it's a lifestyle coaching. It's not just surgery.
To go in and take. Well, that kind of leads into the question. The next one for you is the perception is that this kind of surgery is a quick fix. I think a lot of people, they think, well, it's fine. I'll let myself go. I'll get up there. I'll go to a doctor. They'll fix it, right? Do you see patients like that?
Yeah. So people often have that misconception that, surgery is the easy fix, right? Like you're going to, that person lost weight, but they had surgery,
Right.
And the reality is that there's so much more to weight loss than just eating less and exercising more, right? If that's all you had to do, nobody would need my services.
Right. Well, sure.
Right?
Exactly.
So there's been a few really interesting studies kind of surrounding this, but the general idea is, we used to tell people there's 3,200 calories in a pound of fat. So if you exercise by 3,500 calories in a pound of fat. So if you exercise or eat less by 500 calories a day, times 7 days in a week, you'll lose a pound a week, right? That's simple math.
Sure.
So 500 calories a day, 7 days, 3,500 calories, 3,500 calories in a pound of fat, you'll lose a pound. So that holds true for the first week, okay? The next week you lose a little less than a pound, a little less than a pound. And so at 1 year, when you should have lost like 50 pounds, you'll have actually only lost 20 pounds. So even when they're doing metabolic, they're actually looking at calorimetry, how much people are taking in and putting out, they find that people that have a 500 calorie a day deficit 1 year later only lose 20 pounds. And at that point, they'll actually start gaining weight back rather than continuing to lose weight. So even if they maintain that 500 calorie deficit, they start gaining weight back. So the body is actually fighting against them. So what happens is your body kind of says, well, if you're going to eat less and exercise more, I'm just going to burn fewer calories. And so what happens is people get to that point and they go, why am I still eating less and exercising more, and now I'm gaining weight back? This is ridiculous. Why am I doing this?
Yeah.
And they kind of give up, and then they gain their weight back plus some. So surgery is actually kind of the right operations actually are able to kind of reset that body weight set point is kind of what we call that. And I'm trying to move through that really quickly because I don't want to bore you.
No.
I
do. I think because I think some people do, like I say, they go through all of this, they can get super discouraged then too. And I've got to assume that there's enough people out there too that are like, well, I don't want surgery. I want to just be able to figure this out. But what you're saying is sometimes it just can't happen.
Sometimes, what I'm saying is it's much more difficult than just eating less and exercising more, and that's kind of the main point behind it. And there's so many other things that go into obesity, but the point is that so we kind of tout ourselves on being a comprehensive weight management program, and the idea there is that we really want to meet people where they're at. Some people that means they're ready for surgery. Some people that means they're not ready for surgery. But in the end, many people do end up, getting to that point of surgery because it is much more difficult than just eating less and exercising more.
Right.
And the point that I want people to understand is that surgery is a reset. So I always liken it to playing, the old Nintendo Mario Brothers video game, right? So there was a physical reset button that you could go up and push. Okay, so you're playing a game and you're playing really bad. Okay, you walk up, you hit the reset button, and you start over. Okay, this gives you a second chance, right? It doesn't mean that you're going to play better the second time around. So that's what surgery does. Everybody's going to lose weight in that first year after surgery, and then we're going to reset that body weight set point so it's back at a lower spot, okay? Now that doesn't mean that they can't gain weight back. They did once, and they can do it again. But our goal is to give them the tools and the training to the second time around. So once we hit that reset button, they're able to play a better game the second time around.
Excellent. So before a surgery is scheduled, and I want to mention that there are bariatric programs here in Rapid City, and of course yours is in Spearfish. And you mentioned that there's, did I hear you right, that there's almost a year-long process
Yeah.
before? I mean, in kind of on an average, right? Before
It depends on, right. So it depends some on insurance requirements.
Okay.
It depends on, but kind of our program requirements, it's about a 6-month process to get through. And that's going to involve behavioral health counseling, nutrition counseling, meeting with a medical provider, so myself or one of my APPs, at least once a month during that time period. And a lot of that is, people will ask all the time, like, well, I don't want to see a psychiatrist, I don't need to see a shrink, whatever. Or they say, like, are they going to say I'm too crazy to have surgery? and the point there is, it's not, that behavioral health counseling is not trying to determine whether or not you're sane enough for surgery. It's about trying to say, okay, in what ways do you use food as an emotional, we all emotionally eat, right? So, and some of it is our what we do in society, right? Like we eat when we're happy, when we're sad, we go to a party, we eat, we go to a funeral, we eat, we eat everywhere, right?
Yeah.
So kind of trying to say, okay, if you are sitting there at night watching TV and you get up to get a snack, are you getting up to get a snack because you're hungry, or is it that you're bored and that's what you do at night when you're watching TV? So it's not just thinking about what am I eating, but why am I eating it? What am I trying to get out of this food?
Right.
And so kind of both training people in the sense of like what your body actually needs throughout the course of the day. Which so a lot of times we're not telling. The first step is not cutting things out. It's adding things in. So making sure people are getting enough protein so that they're not craving sugars and other things that their body doesn't need.
Right.
So it's kind of both this nutritional counseling, but also kind of, so not just what you're eating, why you're eating it. And then that kind of leads into surgery. And there are times where people will go through that process and they kind of get to the end and they say, I'm not ready for surgery. I want to keep trying this on my own. And we say, great, we'll work with you on that.
And there must be instances where a percentage of those people can get through and get down to a weight they want.
Yeah. So certainly people do kind of get through that sometimes, and they say, I want to keep going with this.
Right.
And we want to work through them with that. There are other people that enter the program thinking they'll never have surgery, and a year down the road they are having surgery. It definitely goes both ways.
Sure. So they've gone through this process. The nutritionists and the mental health professionals, maybe an exercise program. So once they've gone through all of that and they come to you and say, I'm ready. Okay, then what is the next step? What does the bariatric surgery actually entail?
Yeah, so there's a couple. So we do mainly 2 different procedures, and I just tell people, everything's about risk and benefit. So the procedures that we do tend to be the ones that have the most benefit with the least amount of risk. That's really what we want.
Now, are these like the 2 main?
Yeah.
Okay.
So the 2 most commonly performed procedures in the country, both because of insurance reasons, but also because of that risk benefit profile. Insurance doesn't want you to have complications either. They have to pay for them.
Sure.
Are the sleeve gastrectomy and the Roux-en-Y gastric bypass. And those are 2 that really do offer this kind of, when we talk about that hormonal reset, they actually change the way your body responds to food. And this is another kind of important thing to understand, and the gastric bypass is probably the best example of that. So 83% of people that have diabetes, if they have a gastric bypass, they will get off the operating room table no longer having diabetes. So it's not a weight-related effect. It's truly a hormonal effect changing the way your body responds to food. So when food hits the small intestine releases hormones that kind of improve insulin sensitivity, which is a lot of what our anti-diabetic drugs do. In fact, that's kind of part of how we've learned about some of these drugs. And so it allows that kind of hyperinsulin sensitivity, which then gets rid of people's diabetes. So that just kind of demonstrates that hormonal process. So those are the 2 procedures that are most commonly performed, and that's why.
Oh, that's the whole diabetes thing. Boy, that's amazing that it can actually be
cured.
Yeah.
And I use that term loosely.
Sure.
We always in medicine.
You got to be careful.
Right,
Yes,
right.
absolutely.
Because just like with obesity, I tell people, this is a lifelong process. So when they enter our program, we tell them we want to be a part of your life for the rest of your life because, this isn't something we all struggle with obesity to some degree. And everybody struggles with weight at some point, and you're going to struggle with it again at some point in the future, even if we kind of curbside it for a while. So
when everything is all done and the surgery's been a success, then what are the steps that happen after that? What do these patients have to look forward to? I have to imagine that mentally it has to be such a change in the body and in the mind when it's done for people that have lived like that for so long.
It's amazing. One of the things that really struck me early on when I got into this field is, 20 years ago, people were having bariatric surgery and they didn't get all this counseling. They would just walk in and have surgery the next day, right? And I see these people back because now 20 years later, some of them have a lot of them regained weight, or they're having other problems, or for whatever reason, they're coming back through, and I get these opportunities to kind of talk to these people and hear what's worked and what hasn't. And one thing that struck me early on is the people that I see that didn't have any counseling, but 20 years later they've still kept their weight off and they're doing really well, and they'll say things like, yeah, I've just learned, like, if I go to a dinner party and we're all sitting there, they at these restaurants, they bring us these huge portions, and I've just learned, like, so what I do is I put my fork down and I try to talk to people, and I'll take one bite, I'll pick my fork up and I'll take one bite, and then I purposefully set my fork back down and I talk to people again. So people will kind of pick up on these cues of, like, and that's part of what our training is meant to be, is we want you to enjoy food, to enjoy those settings, to go out in those social settings and to go and do things and be able to enjoy them. That's a big part of life, right?
Right, of course.
But to enjoy them in a healthy way, so maybe you just plan on getting a to-go box and having lunch the next day or dinner sometimes for 2 nights off of that one meal, know. So that's kind of the goal. Right when you get through surgery, there's about a year where you're slowly working up to that, So initially, you're on a liquid diet for 3 weeks essentially, and you're really, I always tell people, it's hard just to get enough protein and water in to stay hydrated. So that's really what we want you to focus on. But as time goes by, your body kind of adapts and you're able to eat more. And as that process occurs, that's where we really want them to start kind of learning some of these other techniques so that they can keep the weight off.
Do you ever have anybody that has the surgery, is relatively successful with it, and maybe years down the road comes back and can do it again?
So,
or is that pretty?
Yeah, there are. The sleeve is a classic one where it's the sleeve gastrectomy it was actually originally designed as the first step in a 2-stage procedure. Okay, so what that was is somebody with a BMI of like 80, so maybe they weigh like 500 or 600 pounds. They're people from that TV show that.
Right. Yeah, we're all familiar with. Yeah,
right.
Exactly.
So they would do a sleeve, and the idea is like, well, we need to do a lot of surgery on this person, and when we're kind of, the gastric bypass, we're rerouting parts of the intestines. There's anastomoses, or parts where we kind of hook intestine together. That's a higher risk thing. So we don't want to do that in a really high risk patient. So they would go in and they would do a sleeve to help the person lose weight. And then a year later, after the person has lost some weight and gotten healthier, they would go back in and they would kind of finish the operation and do some of this rerouting. And what happened is they kind of started realizing, a lot of these people have the sleeve and then they don't ever need the second step. So then it kind of started being just a standalone procedure. So that's kind of the classic example of somebody who might, when these procedures will help people lose an excess % of weight. So if you say, your ideal body weight is 180 pounds and you currently weigh 300 pounds. So you have 120 pounds of excess body weight, essentially. So a bypass is going to help you lose about 70% of that weight, okay? So it's not going to get you all the way down to that 180 pounds. It's going to get you 70% there, right? So that means there are some people who, maybe their BMI is 50, and even if they lose 70% of their excess weight, and their BMI is still going to be 35, which is still technically morbid obesity.
Right.
And yeah, they might end up needing, 2 operations or something further down the road to kind of get them the rest of the way to that goal.
Excellent. Now, the Spearfish Bariatric Program recently earned national accreditation for metabolic bariatric surgery. What does that mean?
So it's the old term for that is Center of Excellence. And,
okay.
Just for
I like that. The Center of Excellence. Of course we are.
Right. Right. Yeah, it says it all, right?
Right. Exactly.
For politically correctness, I think they've moved away from that term.
Okay.
But the idea there is it's just kind of saying there's national standards for centers out there, and they involve your preoperative care, your postoperative care, what you have to offer. Do you have kind of systems in place in case somebody does have a complication where you're going to be able to take care of them, and that's kind of the idea is if a patient comes into your facility, are they going to get a standard of care that we're going to consider excellent?
Okay.
And so you have to kind of meet these certain criteria in order to do that.
Oh, that's pretty cool. So to you personally, what is your absolute favorite part of this job? Is it always the end result, or do you have something else?
So I'm a surgeon. I really like I like the the mechanical
Yes,
aspect of
sure.
it, right? I think that's probably the favorite part of every surgeon's job. Otherwise, we wouldn't do it.
Right. Gosh, sure. That's for guys like me. That's hard to grasp, but I get it. Right.
It is hard. It's different. It's a little bit.
Yeah.
It's not. I always joke because when I started med school, I was an EMT and stuff before med school, but I hate shots, right? And the first time I had to give somebody a shot, like my wife was like giving me a hard time that morning, and like I almost passed out, and so like I'm
gonna get through it, but
now I'm a surgeon,
right?
So it's not quite what people imagine, right? So once you kind of really understand what's happening and the processes occurring, it becomes a very, I'm not going to say mechanical, but it's a very fascinating thing, right?
Yeah.
So just the manipulation of tissue and understanding these kind of planes and how they're going to interact together, and so that is a really fun part to me, but definitely. The other fun part is, seeing these people a year or 2 years down the road, or seeing somebody on the street and they've, they get their life back,
right?
And they're just so excited because they're like, man, I can do things. I have energy.
Wow.
That's a really fun thing for sure.
Dr. Andrew VanOsdol from Spearfish Bariatric Surgeon, thank you very much for sitting down to talk about this a little bit. This has been, it's fascinating. There's so many other questions, more technical stuff I would love to get into, but I think for people that might be listening to this right now and are going through this, I think the thing to take away is, it's a lot of work. I mean, on their part as well. Obviously yours in making sure everything's a success. But you guys are there every step of the way to get them through that.
That is absolutely the goal. Yeah. None of this is the easy solution.
Mm-hmm.
Weight loss is never easy. But that is our goal, is to kind of work with you and meet people where they're at, really.
Right.
And then help them along the way and really be a part of the rest of their life. I mean, I always tell people that is truly the goal, because circumstances are going to change. Life always throws you curveballs. And, for a young person that then has kids, I mean, that's a whole nother level. As you're older and your kids leave, maybe then you're taking care of your mom. Life is just constantly changing and throwing curveballs at you. And we want to make sure that you're adapting to those things in a healthy way.
Excellent, Doctor. Thank you so much for talking to me. This has been a lot of fun.
Thank you.
Appreciate it.